Hi, this is Andrew with Zang Physical Therapy, and today I wanted to come back on and answer some questions that I've received over the last few days regarding can your knee issue be helped at home based on what I talked about the other day. So the first question that I received is, my knees crunch when I walk up and down the steps and stand up from a chair. Is this anything to be worried about? Honestly, not really. A high percentage of people walk around with creaking or crunching or however you want to describe it and are just fine. In many cases, these noises that the knee makes isn't even painful. So especially in those instances, it's nothing to worry about. But if you do have some concern or worry about it, there are things that can be done, such as stretching out your thigh muscles as well as strengthening up your leg muscles. As a profession, we've seen plenty of people who have these issues, and they can be reduced if you're willing to put in a little bit of work. But again, if it's not painful, it's not something really to worry too much about. Number two, it says, I feel like I can't straighten my knee when I walk. My orthopedic says that all I can do is have surgery. Is there any other option? Well, there absolutely is another option, and it's called physical therapy. So why can't you straighten the knee? Without touching your knee or asking more questions, I can't know for sure. But there are various stretches and mobilization techniques that physical therapists can do that can help to straighten the knee. And as a result of that, probably reduce some pain and also reduce the likelihood of getting some compensatory pain in either the hip, the back, or the other knee. Because if you do walk around with a bent knee for too long, chances are something else is going to hurt. So my advice to you is call your nearest physical therapist that you trust, and one of us can assess the situation and try to help you. And if we can't help you, then by all means we can point you back to a doctor who can help you out there. So question number three, my doctor told me that I have arthritis and that I can't do anything but have injections 3 or 4 times a year, and when I give up and it becomes too painful, eventually have surgery. I'm not really interested in needles or surgery. Is this something that PT can help? The answer is yes, 100% of the time. PT can be helpful. To what degree can we help, and do you view it as a success? Those are different questions. For anybody, especially early on, maybe you're in their 40s or early 50s, and you may just be slightly bothered by your knee, or you might not even be bothered much at all, and they just happen to take a picture of your knee and say, oh, you have arthritis. Well, that's really the best time to be consulting a physical therapist, and this is when we can be most helpful for people. And once again, you're going to hear a common theme here, working on flexibility, balance, strengthening, overall endurance. These are things that can greatly help any individual who may have arthritis. Again, arthritis is just normal wear and tear, normal aging of the joints. And by improving your strength, flexibility, balance, those things, you can ward off a lot of negative things that happen. Now, if you've had this issue and need pain for 10 or 15 years, the overall success rate with something like physical therapy is going to be a little bit reduced. But things still can be done to help you out. So, if you're somebody who has been told you have arthritis and you want to continue to be active and enjoy life, and you don't really want surgery, you're not trying to take the easy way out, then consulting a physical therapist early is really your best option, so that we can help teach you what to do from a long-term maintenance perspective. Okay, so those are the 3 questions that I got for this topic of knee pain and can something be helped. If you do have any other questions, by all means, put them in the comments section below. I'll get back to you, or send me an email, andrew@zangpt.com, and I'll personally respond to your emails. I hope this information is helpful. And again, this has been Andrew with Zang Physical Therapy. Have a nice day.